Minister Dr. Motsoaledi detailed amendments for the medical scheme bill that will be later debated in Parliament. He says these amendments are meant to provide relief to patients finding themselves in financial distress due to the high cost of healthcare in the country.
The objective of this Act is to establish a fund that aims to achieve sustainable and affordable universal access to healthcare services by, number one, establishing and maintaining an efficient fund through the consolidation of revenue so as to protect users against financial risk. Two, serving as the single public purchaser of health services in terms of this Act so as to ensure the equitable and fair distribution and use of healthcare services. Three, ensuring the sustainability of funding for healthcare services. And four, providing for equity and efficiency in funding by actively purchasing healthcare services, medicines, health goods and health-related products from certified, accredited and contracted service providers. As it is now generally accepted, the cost of private healthcare is out of reach of many citizens, even the well-to-do ones. The data at our disposal shows that medical schemes are holding in reserve, as I'm speaking now, close to 60 billion rand that is not being used. Granted, of course, there is a statutory requirement, meaning requirement by law, that medical schemes should have 25% of their income in reserve, because this is to cater for emergencies. But our problem, our bone of contention is that this 60 billion rand is equivalent to 33% reserves, which means unnecessary accumulation at the expense of patients. We believe these huge reserves were accumulated partly through high premiums, because we know that for the past 15 years, medical scheme premiums for every medical scheme member has been increasing by more than consumer price index. So we believe that money went on for accumulation of reserves. But it's also the issue of core payments, which I'm saying we're abolishing, because from the records we have, in the last financial year, people pay core payments from their pockets to the tune of at least, if I'm not mistaken, I'll correct it if I am after checking, I've got the records here. People, members of medical scheme in core payments, have paid a sum of 29 billion rand. This scares us. While this is happening, the population of medical scheme beneficiaries need immediate relief from serious challenges experienced in the current medical aid scheme regime. The nature and the magnitude of the challenges is such that it will be undesirable for medical scheme beneficiaries to have to wait for long-term changes that are definitely coming. The second reason for the amendment is to align the medical scheme environment to that which will exist under NHI, so that there is a smooth, harmonious transition that does not unduly disrupt access to health care.
Well, to shed some more light on the National Health Insurance is Dr. Anthea Jeffrey. She's the head of policy research at the Institute of Race Relations. She joins us on the line from Johannesburg now. Doc, you've just heard the NHI being gazetted by the Health Minister, and can you just give us your initial reaction to the amendments he's made, and tell us why you have a very worrying picture in mind should the NHI actually roll out in the country?
Hello. Well, I must say I haven't yet had the opportunity to look at the measures which are being gazetted. But I did look very carefully at the NHI green and white papers on which they are presumably based. And the key question is whether fundamental problems with the NHI concept are being addressed or not. And let me just say that, of course, it's important to have universal health coverage, but the NHI is not a good way of achieving it. And if I can just focus on three key problems. The first is affordability, whether we can possibly raise the revenue required to fund it. The government has never done a proper analysis of what it will cost. The only figure it's provided is that to suggest it will cost $256 billion in 2025, which is when it's supposed to be fully rolled out. But that's a 2010 figure. It wasn't realistic then, and it's even more unrealistic now. It's much more likely that the initial cost would be about $600 billion and that it would escalate very rapidly thereafter. And yet, South Africa is limping along with a very low rate of economic growth, with a big hole in the revenue fund already, because the tax we're able to bring in is not enough and our public debt is growing so strongly. And the tax increases which were suggested as a way of funding the NHI have already been introduced. For example, it was thought that a 1 percentage point increase in the VAT rate could fund the NHI. But we already have that just to help the government discharge its current responsibilities, let alone pay for something as expensive as the NHI. And then secondly is there the issue of other resources, healthcare resources. We have a limited number of doctors, specialists, nurses, and other health professionals. And there's a real risk that when the NHI is introduced, some of the private practitioners may find it unacceptable that the government sets their fees, that they have to rely on a probably inefficient NHI fund to pay them, that they won't be allowed to practice where they want, that those who are in urban areas might, for example, be expected to move to rural areas. And anybody who has to pack up and move might decide not to stop at the rural area, but rather to move right out of the country. In terms of the public sector facilities, they have to pass an accreditation test. And we just heard from the Office of Health Standards Compliance that only 15% of our public clinics and hospitals, as recently inspected by that office, would be able to participate in the NHI. The remaining 85% are unable to comply with basic norms and standards. Things like maintaining proper standards of hygiene or having medicines adequately available. So if we can't rely on our public sector facilities and our private ones are diminishing, then there simply isn't going to be enough supply of healthcare to meet the demand under NHI.
Doctor, what are the key reasons right now for driving up healthcare costs in the country, do you think? Is it increased utilization, or do you put it down to costly new medicines and technologies?
It's all of those factors. Of course, we haven't, the population demand is increasing. We have various drivers of need here, from HIV/AIDS and a high rate of traffic accidents and assaults and so on, to the fact that the burden of disease is large. We also have, as you said, new technologies, new devices, and so medical inflation normally outstrips ordinary inflation. In both the public and the private healthcare sectors, it's been going up by about 9 percentage points a year. And NHI is not going to do anything to address that. The government pretends that if we have an NHI fund which will do all the buying, and the government itself will set the prices, that will make it much more efficient. But the reality is that the government prices will often be too low to maintain supply, or they'll order the wrong amount of the wrong thing, and then what is really needed won't be available. There'll be a great deal of inefficiency in the system, which will drive up overall costs. And so too will all the expenses of having to maintain the huge bureaucracy needed to run the NHI fund.
Dr. Anthea Jeffrey, thank you for your time on the SABC News Desk. She's the head of policy research at the Institute of Race Relations, on the line to us from Johannesburg.